Do you get thumb pain or even up into the wrist discomfort when you're on the rowing machine? Well, this video is for you. So let's talk about what it is, why it can happen, and some things that you can do to try and stop it on the rowing machine and off the rowing machine.
So I initially filmed the beginning of this video and had a bunch of anatomy and realized that the video just got longer than I think is necessary. So if y'all want the anatomy of what's going on, please comment below and I'd be happy to make a video on that and post the part that I took out. But in essence, you've got some muscles that are in the actual thumb here, and you've got some muscles that run along the outside and down into the forearm, which is why your pain could be in any one of those spots. And usually it's from being repetitive or putting extra strain onto your thumb when you don't need to. And sometimes it's inflammation in this little area that the tendons are trying to go through, and they're just kind of getting trapped and they don't have a lot of space to be able to move because they're surrounded by this really, really thin sheath. And if you have inflammation there and we just constantly keep aggravating it, essentially all we're doing is causing more and more compression and more pain. So that's kind of the brief overview of what could be happening. You could look up words like de Quervain's syndrome or de Quervain's tenosynovitis or tendinitis and find out more. But that's kind of a brief overview of what could be going on.
But before we jump on the rowing machine, I want you to just think about your hands. And I want you to just kind of put your hands out in front of you and just take a look at them. See what that natural position is that our hands and our thumbs kind of want to go to. So my thumb is not necessarily up, it's down a little bit, right? And it's at a little bit of an outside position. So we're gonna take this position when we go to the rowing machine. So let's jump on the rowing machine and go over some things to pay attention to while you're on the rower that might be contributing to some of this discomfort. And then stay tuned because I'm going to show you some exercises and things to do when you're off of the rowing machine that are going to help as well. First thing I want you to think about is actually the gripping that you are doing on the handle for the rowing machine. So one of the things that you want to consider is because these muscles are all the way up in our forearm, what's happening in our shoulder and our elbow also contribute to the position on our hands. If I have to bring my arm in and rotate to get me in a more neutral position, I can actually do that rotation just from my elbow and my forearm moving, or I can do it a little bit with my shoulder. So if you've got anything going up the arm or anything like that, that can play into this. So I also recommend checking out this video above that is about getting that shoulder in a good position to stop that aggravation. But let's get back to just the positioning right now. So one of the first things that you want to think about is when we did that position and we just put our hand into a neutral position, we often are doing that with our arms straight in front of our shoulders. So if you just take your arms and you stick them out in front of you, I'm not usually doing that and bringing my arms in or keeping them really far out. I'm putting them where it's in a comfortable position, which is usually straight in front of my shoulder, right? So when you grab that handle, I want you to think about getting your hands straight in front of your shoulder. Oftentimes, that means bringing our hands closer to the edges of the handles. So if you are holding the handles here, that means that you are probably bringing your arms inwards like this instead of being in front of the shoulder. So find a spot that brings you into that happy neutral spot for you. And if you just grab the handle where it's nice and gentle with your fingertips, that right there is kind of doing what we did here. Just relaxing, putting your hand in front of you. See where your thumb goes. For me, you can see my thumbs kind of hang down. So having them below the handle can be helpful. However, when it cannot be helpful is if you are a person, when you are rowing, you are really gripping, and we call it death gripping. If you are gripping really hard on that handle, then you're kind of just constantly creating a grip and your thumb is spaced in between, so you're constantly gripping and gripping and gripping. That can cause a lot of discomfort. So one of the things to also consider with that is sometimes having it below, but really just having a lot of that pressure and just holding from the fingertips is really helpful. So I can row and never have my thumb even touch the handle. And I can row for hours just like this. And all that's happening is that handle is just on this part of my fingers. So finding your starting position on where your hands should be, trying your thumbs into a neutral position if you can, If you notice that you are death gripping, try just going to your fingertips and see if it's okay where you're not overusing those forearm muscles and those gripping muscles in your thumb muscles to row when you don't necessarily need to use those muscles. Most of what we're using is coming from our legs and our core and our back, not necessarily our hands. Another thing that you can consider is if you're not really comfortable with it like this and you want to have your fingers more around it, you could play with having it above, having it below. You could even alternate 500 meters here, 500 meters here. You could even do them just kind of like this. So totally up to you, really just play around with the positioning, but try not to over grip because that's gonna put a lot of extra pressure here. Another thing that you wanna consider is, again, because those muscles go into our forearm, we've gotta pay attention to the elbow. So if we're paying attention to our elbow position, when we're rowing and we go, 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 do you bring your elbows out to the side and kind of pull up here? If so, and I take that position and I bring it just where you can see it in front of me, essentially what's happening is we are deviating at the wrist. We're putting a lot of stress on these thumb muscles, so we're deviating at the wrist. Then we're bringing our elbow out and up, which sometimes creates this curl like this, so flexion of the wrist. We're doing a lot of funky things to the wrist position just by changing our elbow pulling up. So our shoulders and our elbow pulling out and our shoulders kind of pulling up to get the handle into a higher position completely changes my wrist position, which puts so much more strain onto this thumb position and those muscles. So here I'm deviating, I'm bending, and I am putting a little bit, I'm holding that oar or that handle with a little bit more of an actual grip versus just having that pressure through here. So record yourself. See, where are you pulling to? Are you pulling up high? Are your elbows kind of in, or are your elbows actually in and you're doing this? Because that's creating a similar deviation at your wrist. So if you are a person who is having thumb discomfort, you really want to think about pulling straight into right here at your chest, where everything stays in a nice neutral position for you. You're using those back shoulder muscles to really pinch your shoulder blades together, and it's just a back and forth. That's putting no extra stress on the elbow. It's taking the stress out of your thumb and your wrist muscles. So looking at that positioning is going to be really helpful. And again, checking out that video on setting your shoulders into a good position. I'm not going to go into that here because I want this video to not be super long and I want to go over some exercises for you. So let's jump off of the rowing machine and go into some things that you can work on if you are having some of that discomfort. Okay, so the first exercise is, and these are going to be specifically about the wrist and the thumb primarily, not necessarily going into the shoulder and the elbow, but the first exercise would be just finding something that's pain-free for you. So what I recommend doing is starting and having your arms supported on something like a bench. I would grab one if I could, but just having your arms supported on something like this, and you're just going to take your thumb and you're going to go up and down. Like you're giving a thumbs up, but your fingers are straight. So up, down, up, down. Now a key with this isn't about being fast. That's gonna be useless for you. I want you to kind of go and get a little stretch and then come back down. Stretch, come back down. Try about 10 of those. See if that's comfortable. For all of these, start with about 10 of them. Then if you're good the next day or 2 days later, you can work on increasing to doing 2 different sets of it, or increasing your reps to 15 or doing 2 sets of 10, something like that. But for now, just start with 10. Make sure that you're comfortable, you're not overdoing it. Research shows that tendon things for tendinitis and tenosynovitis is really about getting a little bit of load through those tendons. So this is actually doing some stretching, but also a little bit of strengthening. You are using gravity as your resistance. So that's the first one. Then the next one is, again, nice and supported, but your arm kind of coming this way so you can see it. The first one was going straight up like that. Now we're gonna actually go inwards. So it's gonna be more of a going away from your palm. Just in and out. And again, start with 10 of these. Nice and simple, stay in the range that's pain-free for you, and just do 10 of those. All right, so we had going upwards, we had going outwards or inwards like that. Then the next one's actually gonna be coming across. So we're gonna take our hands, and we're actually gonna have our palm nice and open, and we're gonna take our thumb and we're gonna go reach across as far as we can to our pinky. You can bring your pinky to meet it, but I want you to go as far as you can across and then come meet it. Again, fast is not the name of this game. We're going nice and slow, and then you can switch and go to a different finger. And then another finger, and another finger. And again, 10 of these, just like we mentioned to get started, and then you can increase the amounts. This should be pain-free. If it's aggravating it, stop. It might be that you've done 1 exercise, 2 exercise, 3 exercise, or the range of motion is too much. Relax, try again later, or try the next day. But we don't want to aggravate it, but we want to get blood flow going to the area to help with the inflammation and help get healing properties there. So we're putting those muscles and tendons under a little bit of load, and we're going to do a little bit more load as well, but we're putting them under load and we're getting them moving, which is really important for a lot of this. So ups and downs, outs and ins, however you want to call that, and then going across to each finger is your starting point. Okay, so another exercise that you can try is actually with a rubber band. And I came inside to try and find one, but we're gonna use a hair tie. Start with something nice and like a lighter one that doesn't have too much resistance, and then work your way up. But you're gonna take it and you're gonna put it just around all your fingers, just like that. Then what you're gonna do is you're just gonna open and close. And ideally this hair tie, mine's very, very stretched out, so your rubber band ideally keeps a little bit more of the tension when you come in, and you want to kind of keep some of that tension when you come in so that it just doesn't like fall off your fingers. But open, close. Again, about 10 of them, but you really might feel that through here. As long as it's not painful and it feels like it's working in soreness, see if you can differentiate those feelings, because that's what you're going for. Try to open all your fingers nice and kind of equal if you can, instead of having just one go out, otherwise it rolls down to your wrist. The other thing that you can do is just do the thumb. So you can keep your other fingers closed where they're not splaying out, and that will isolate it a little bit more to the thumb as well, so you could give that a shot. So the next one that we would do is actually with a light weight, and I recommend starting light because you want to load the tendons, but you don't want to increase the inflammation too much where you're getting more discomfort. So start with like a can of peas or something like 1 pound weight, nice and gentle, and then work your way up. Okay, so a can of peas works really well for this, but since I'm out here, I'm gonna use this. So you can do this on a table at home, but I'm just gonna use this because I have it. So what you're gonna do is you're gonna have your forearms supported. Ideally, the rest of your body is in a more comfortable position than this. And you're gonna have your wrist so it's over the edge. You're gonna grab your can of peas or your 1 pound weight, and you're gonna go slowly down and slowly up. Slowly down, slowly up. If this hurts, take away the weight and just use gravity. In terms of open palm versus closed palm, it's whatever's comfortable for you. Again, try about 10 of those, then we're gonna go into some stretches. All right, so for the stretches, what you're gonna do is you're gonna take your hand and you're gonna be like, stop! So arm just out in front of you like this. Then what you're gonna do is you're gonna take your other hand, and don't forget to include your thumb with this. I want you to get your thumb and your palm, so like that, and I want you to come up. You should feel a stretch through here. You might feel it in your thumb as well, but you're just gonna get a stretch like that. If that's too much, lower so that your arm is down like this. But you can come up here if you've got a little bit more motion and flexibility like I do. Then you're gonna do the same thing, but we're gonna reverse it. So instead of stop, we're gonna go downwards, just like that. And then same thing, don't forget to include the thumb when you grab, and you're gonna gently pull. I recommend starting this nice and soft and gentle. If you're feeling a stretch through here, perfect, that's what we're going for. You could also feel this in the thumb. But hold that for about 30 seconds, so 30 seconds of this one and 30 seconds of that one. Research shows that for static stretching like that, your goal is to actually get up to 2 minutes, but to not stretch for over a minute at a time. So 30 seconds 4 times or a minute twice. Feel free to do this on both sides. It might be something that, especially if you're sitting at a computer all day, can be really beneficial for you. But try those stretches out and see how it feels. Again, if something really aggravates it, stop. And of course, my disclaimer, I am a medical professional. I'm a doctor of physical therapy, but this is not medical advice. So if you're having more discomfort or anything, please feel free to reach out to me or another physical therapist or a doctor and follow up with somebody. Another big thing about this is you want to think about the things that you are doing off of the rowing machine. And sometimes it gets aggravated from us doing the rowing movement, but things that we're doing when we're not on the rower can contribute to this a lot. And a big one is actually texting. So when we grab our phone and we're doing things like this, all of that is putting a lot of stress. You can see my little Pokemon. A lot of this is putting stress on our thumb every time we're moving our thumb, reaching across, doing all those different types of things. That's actually similar to, it's using those muscles, and it can cause to increased aggravation. So if you are having some of that discomfort, I urge you to also think about the things you are doing when you're using your thumb off of the rowing machine. So if you notice it more at night or in the morning, or when you're just scrolling on your phone, those are things to really think about and try and decrease that aggravating factor.
While this video is made for people who use the rowing machine primarily or erging, if you happen to be somebody who rows on the water, there might be some other reasons that it's happening, like feathering, for instance, but the exercises at this end of this video are helpful regardless of what the reason is. And sometimes when we switch from crew and doing rowing on the water to erging or using the rowing machine, when we do that switch, sometimes we end up changing the movement pattern that we are doing when we're on the erg. So paying attention to what we're doing on the rowing machine as well can contribute and might be something that's actually contributing to it. So keep that in mind.
I hope that this was helpful. I really recommend checking out this video about what to do on the rowing machine to really set your shoulders in a good position to help with the pulling stuff that we talked about earlier. So definitely check that out.